Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. I have made up another mock exam for you all, so I will be going through it with you a little bit because keep in mind that if you are a Dentalelle member, you get full access to all mock exams, all teaching videos, all PowerPoints, all everything for up to 4 years, you guys. So that's a long time. Plus, I do hold a live tutoring session every other Sunday for all Dentalelle members. So if you're not a Dentalelle member yet, you probably should be. The mock exam that I will be showing you now is actually part of our session, not this Sunday, but next Sunday. And our sessions last about an hour to an hour and a half long, where I go through a new topic every single session, and we go through mock exam questions. And if you have any questions or concerns about anything, then is your time to ask because I will help you. So without further ado, let's go through some questions. Let me just share my screen here. Let's see, where are we? PowerPoint. I'm just looking for my PowerPoint here, you guys. Can everybody see my screen okay? I do have my newest mock exam package up here. We will go through a couple of the questions because the rest of the questions you can join me if you are a Dentalelle member next Sunday because I will be talking about everything then. So, okay, so let's go through, let's say, the first case study. Now, I actually have to make myself smaller so I can see what the question is. Okay, so Lisa is a patient who hasn't had her teeth cleaned in 20 plus years. She doesn't feel the need to get them cleaned, and she is only here for her sore tooth. The upper left first molar is cold sensitive. So this is the case study that we need for the next 3 or 4 questions. So first question. What is the source for subgingival calculus? Is it A, saliva? Is it B, plaque? C, sulcular fluid? Or D, smoking? So if you need to take a second to think about it, take your time, but I would pause the video and then come back as soon as you have the answer. So what do you guys think? So what is the source for subgingival calculus? So anytime we go through a question, remember to pick out the key words. So in this case, it's subgingival calculus. So I'm not talking about plaque. I'm not talking about supracalculus. I'm not talking about saliva, but I'm talking about what is the source. So I should say another key word is source for subgingival calculus. So what do you guys think the answer is? The answer is sulcular fluid. Okay, so a lot of you guys may have been thinking saliva, but that's not true because we are talking about subgingival calculus. If it was supragingival calculus, saliva would have been the best answer. But we are talking about subgingival calculus, which means underneath the gum line. So what happens underneath the gum line is C, you have sulcular fluid. Okay, so that is the best answer. If there's any questions, please just let me know. And of course, if you are a member of Dentalelle, you can ask me questions anytime live. So once again, if you're not a member yet, you should be. Okay, so next question here. So, okay, so what is the source of supragingival calculus? And I kind of had given you guys the answer. I'm sorry. I forgot that I had this question in here. So again, though, please pick out the key words. Even if you're not sure, look at all of the answers and then say to yourself, well, which one could it not be? Or which two could it not be? And then you may be left with 2 answers, and then you have to say, well, which one is the best, you know, which is the best answer? So for every single mock exam question, you do have to go through a series of steps of thinking, if that makes sense, because a question may seem easy to you, but if you're taking the board exam soon, you need to think of things a little more thoroughly, because if you don't, then you may not pass it because you are thinking about things too quickly. So always look for the key words and look at all of the answers also. Okay, so the answer is saliva. So again, I apologize. I had given you the answer in the last question, but that's because I forgot that I had this question in here. So let's just move on to another one. Okay, so these tooth numbers are referring to the Canadian and not the American, okay? I do have a chart for the American on the next one here, but the question is, what tooth could be bothering Lisa? So if you don't remember, move over to the case study here. She said it's the upper left first molar, okay? And this may seem like a simple question for you, but a lot of students tend to get confused on the board exam. They think to themselves, well, is it my right or their right? Left? Is it my left? Is it their left? So I would like to talk about this with you. So again, these answers here are the tooth numbers for Canadian exams. But the chart here is for the American, okay? So notice how the tooth numbers are different. It goes from 1 to 32. Whereas if you were taking the Canadian exam, it would be here the 1-8, the 2, or the 1-8, the 1-7, 1-6, 1-5, 1-4, 1-3, 1-2, and 1-1, and then over to quad 2, 2-1, 2-2, 2-3, and so on. Over to quad 3, 3-8, 3-7, and so on. Over to quad 4, 4-1, 4-2, 4-3. So this is for the American, the universal. But the answers here are for Canadians though. So once again, for the case study, it's the upper left first molar. So which tooth here is the upper left first molar? Okay, so let's look over here. The upper left first molar, upper left. Think about that. So think about, I guess, if you're looking at the patient. So if they're laying back in the chair and you are looking at the patient, you know, the right side is this side here. The left side is this side here. So the left side, quads 2 and 3. Okay, so right here. So the upper left, first molar, is tooth 2-6, okay, because the 6s are the first molars, the 7s are the second molars, and the 8s are the third molars. So again, this is for Canadians. Let's go through one more question because I don't want to give too much away because I'll be talking about this in about 2 weeks' time. With all of my Dentalelle members, we will be talking about it live. So exciting, right? Okay, so what could be the cause of cold sensitivity? So again, look at the key words here, cold sensitivity, because she did say that her tooth is cold sensitive, right? So could it be A, a cracked tooth, B, a cavity, C, a dead tooth, or D, recession? What do you think? So pause the video if you're not sure. The answer is D, recession. So anytime a patient has cold sensitivity, it could be a number of things, but the best answer is recession, okay? A cracked tooth would be if the patient is sore when eating or if it's sort of pressure sensitive. A cavity is typically if they're sensitive to anything sweet. And C is if they're sensitive to hot. The tooth could be in the process of being non-vital, but if it's a dead tooth, they likely will not feel anything. But if it's starting to die, but it's not quite dead yet, then they are sensitive to heat, okay? So the next question, if you want the answer, you should see us live. To become a Dentalelle member, all you have to do is, let me write this down for you guys, is you just have to go to dentalelle.com. Easy, easy, easy. And to become a Dentalelle member, you have full access to everything, you guys, for up to 4 years. So you obviously probably don't need it for that long unless you are in your first semester of the dental hygiene program, which is about 2 to 4 years, depending on where you live. For dental assisting, it's typically you're in the program for a year to 2 years, again, depending on where you live, but you still have full access for up to 4 years. And I do that because, you know what, you guys, life happens. I had a student who, this was last year, but she had started the program. She became a Dentalelle member last year. She was in her first semester, but then she found out that she was pregnant. So a year later, or actually about 6 months later, she quit the program, or I should say she put her program on hold, and then she went back to first semester. She's not planning to go back actually for another year or two, I think. So she has, though, full access to this whole program for up to 4 years. So if life happens, that's okay, because you have full access for up to 4 years. So if you're not a member yet, you should become one. So to become a Dentalelle member, and then I can see all of you live every other Sunday for a full mock exam sort of questions, answers. And if you have any questions, you can let me know, because we have live sessions every other Sunday. Okay, so let me just stop sharing my screen here. So I do hope that helped. If you need anything, please let me know. And if you're not yet, please become a Dentalelle member so that I can see you guys all inside every other Sunday. Okay? See you guys later.